Good evening to our listeners and to our viewers, and welcome to this evening's session, which is osteoarthritis, and my name is Dr. N.N. Putuka. You may be wondering why osteoarthritis today. The 12th of October is World Arthritis Day. Hence, we came up with this topic. And if you listened to Julia on Tuesday, she did mention osteoarthritis. And if you listened to Tongs yesterday, she spoke about the foods to eat, the foods to avoid in order not to harm your joints, and the best exercises to do for osteoarthritis. And the other thing is the 12th to the 20th of October is World Bone and Joint Week. Just a few facts on arthritis before I talk about osteoarthritis. Arthritis is a general term for conditions that affect the joints or tissues around the joint. There are more than 100 types of arthritis. Most types of arthritis cause pain and stiffness in and around the affected joint or joints. Some types of arthritis, such as rheumatoid arthritis, also affect the immune system and some internal organs of the body. Arthritis can cause a range of symptoms and impair a person's ability to perform everyday tasks. Physical activity has a positive effect on arthritis and can improve pain, it can improve function, as well as mental health. Factors in the development of arthritis include injury to a joint or trauma, abnormal metabolism, genetic makeup, which is also referred to as hereditary, infections, and immune system dysfunction. When it comes to arthritis, treatment aims to control pain, to minimize joint damage, and improve or maintain quality of life. It involves medications, physical therapies, and patient education and support. Now, what are the most common types of arthritis? The most common type of arthritis is osteoarthritis, which we are going to talk about today. And other common types of arthritis include rheumatoid arthritis and gout. What is rheumatoid arthritis? We spoke about rheumatoid arthritis in our previous lessons or sessions rather. Rheumatoid arthritis is an autoimmune and inflammatory disease, which means that your immune system attacks healthy cells in your body by mistake, causing inflammation. And inflammation is commonly known as painful swelling in the affected parts of the body. Rheumatoid arthritis attacks the joints, usually many joints at once. Rheumatoid arthritis commonly affects joints in the hands, the wrists, and the knees. And rheumatoid arthritis actually is symmetrical. It does not only affect one side of the body. If you have it on your knee, your right knee, you will also have it in your left knee. And that's how we can distinguish between rheumatoid arthritis and osteoarthritis. And what is gout? Gout is a common form of inflammatory arthritis that is very painful. If one has experienced this kind of pain, they will never forget it. It usually affects one joint at a time, often the big toe joint. There are times when symptoms get worse, and it is known as flares, and times when there are no symptoms altogether, and this is known as remission. Repeated bouts of gout can lead to gouty arthritis, which is a worsening form of arthritis. There is no cure for gout, but you can effectively treat and manage the condition with medication and self-management strategies. Now, coming to today's topic, osteoarthritis. So what is osteoarthritis? Osteoarthritis is the most common type of arthritis that frequently develops with age. It is a chronic condition in which the cartilage between bones that cushions the joints wears down, and as it does, the bones rub against each other, causing pain, causing stiffness, swelling, and reduced joint motion, joint mobility. Osteoarthritis commonly affects the hands, the knees, the hips, the feet, and the spine. However, it is not only limited to those joints, it can affect nearly any joint in the body. Now, let's move on to the symptoms of osteoarthritis. Symptoms of osteoarthritis typically begin after age 40 and can vary widely. Symptoms of osteoarthritis most frequently affect the fingers, as we mentioned, the feet, the knees, the hips, and spine, and less commonly, it may also affect the elbows, the wrists, the shoulders, and the ankles. Now, symptoms include the following: joint pain. This kind of pain worsens with activity and is relieved by rest. In severe cases, joint pain occurs even at rest or even at night when you're trying to fall asleep. Pain is felt over or near the affected joint, but it may sometimes be felt in other areas. The second type of symptom is joint stiffness. Morning stiffness is a common symptom of osteoarthritis. Stiffness usually goes away within 30 minutes of rising up, but it may come back throughout the day if a person is inactive. So what does this say? It says moving a lot, being active, helps you deal with joint stiffness. Stiffness may occur in cold weather, damp weather, or low pressure weather. The third symptom of osteoarthritis is joint swelling, which is also known as effusion. And then we also have crepitus. In orthopedic medicine and sports medicine, crepitus is described as a popping, clicking, or crackling sound in a joint. This sound means that there is air moving in the joint, and it is usually harmless. Another symptom of osteoarthritis is changes in the shape of the joint. And finally, you may get bone spurs, which are also known as osteophytes. Now, what are these bone spurs? Bone spurs are bony growths that develop on the edge of a bone, sometimes causing symptoms. This symptom will be pain and limited movement of the joint. The problem is that bone spurs do not go away on their own. And the other factor is that bone spurs may also be an indication of other issues such as degenerating or herniated discs. Degeneration is what you get as you age. And eventually, surgery may be the only option to treat bone spurs. Now I'm showing you an image of the osteoarthritis of the knee. The image on the left side, my left side, shows a healthy knee joint. You can see there's a healthy femur bone with healthy articular cartilage, with joint space between the femur and the tibia bone. And on the other side, you have osteoarthritic knee image, which shows the sparing femur bone. You see the bone spurs on the femur bone. You also see degenerated articular cartilage, which shows that it's actually touching on the tibia bone, which also has bone spurs. And from the look of this image, you can tell that this is definitely painful. So now, what are the 4 stages of arthritis? The stages of arthritis range from stage 1 and to stage 4. Stage 1 is referred to as minor arthritis. In this stage, you get minor wear and tear in the joint. A patient may present with little pain. Sometimes the patient might not even have pain in the affected joint. And now stage 2. Stage 2 is referred to as mild osteoarthritis. This is now when you get more noticeable bone spurs, which are those bony growths. Stage 3 is referred to as moderate. You get cartilage in the affected area beginning to erode. I think if you can have a look at our image there, it shows that the cartilage is actually becoming eroded. And finally, stage 4 is referred to as severe. This is when the patient experiences excruciating pain in the affected joint. Now, what are the risk factors of osteoarthritis? Primary osteoarthritis is actually the breakdown of cartilage over time. Risk factors for developing osteoarthritis include advancing age. It is very rare for people under the age of 40 to develop osteoarthritis. But however, if you can take images of people who are above the age of 55 or 60 without any complaints, without any symptoms, you may find that their x-rays will be in agreement with osteoarthritic changes. Gender. Women are more likely to have osteoarthritis than men. And I'm sure you're wondering, why is that the case? Women's joints are more lax than men's joints. The bones move around more and are less stable within the joint. When joints have less stability, they are more prone to injury, and injuries can lead to arthritis. Obesity is also a risk factor. Carrying extra body weight does more harm to your joint. Hence, it predisposes you to osteoarthritis. Now, occupation is also another risk factor. Occupation that requires frequent squatting and kneeling, such as your mine workers, such as farm workers, construction workers, and other activities that involve heavy lifting or prolonged standing or walking several miles each day can predispose you to osteoarthritis. Joint injury or trauma also predisposes you to osteoarthritis. And we have certain types of sports that may actually predispose you to osteoarthritis. These include wrestling, boxing, cycling, gymnastics, soccer, and even football. However, science has shown that non-competitive running does not seem to increase the risk of developing osteoarthritis. Now, moving on to diagnosis. How is osteoarthritis diagnosed? Osteoarthritis is diagnosed based on a number of factors, including the patient's age. We've just heard now about the risk factors, history of the patient, and symptoms. So you can see that history taking is actually very important in helping you diagnose osteoarthritis. So you need to take your patient's work history. What kind of work do they do? Dietary history, what foods do they eat? Having listened to Tong's presentation yesterday, you may probably know which foods predispose you to acquiring osteoarthritis and which foods might protect you from osteoarthritis. You also need to take history. If the patient is physically active, you need to know what kind of sports are they doing. That can help you diagnose osteoarthritis. And you also need to find out if there's ever been any injury to the affected joints. Has the patient ever been involved in a car accident or a fall that may have affected the joint, that may have also warranted a surgical intervention? And now, what kind of investigations do we do to diagnose osteoarthritis? Tests to diagnose osteoarthritis or rule out or any other conditions may include imaging. Imaging is done to get pictures of the affected joint. The treating doctor may recommend an X-ray. Cartilage does not necessarily show on X-ray images, but cartilage loss is revealed by narrowing of the space between the bones in your joint. If you recall the picture that we showed earlier, the osteoarthritic knee showed no space between the joint, but the healthy knee showed some space between the upper bone and the bottom bone. An X-ray can also show bone spurs around a joint, which is a symptom of osteoarthritis. Another type of imaging that we may use is magnetic resonance imaging, which is known as MRI. An MRI uses radio waves and strong magnetic field to produce detailed images of bone and soft tissue, including cartilage. An MRI is not commonly needed to diagnose osteoarthritis, but it can help provide more information in complex cases. Another type of investigation that you may do is arthroscopy. This is a surgical procedure that doctors use to look at, to diagnose, and to treat problems inside a joint. It is a minor surgery and is done on an outpatient basis, which means you can go home the same day that you've had the surgery performed on your joint. The doctor may recommend it if a patient has inflammation in a joint or have injured a joint, or the patient has damaged a joint over time. You can have arthroscopy on any joint. However, most often it is done on the knee, the shoulder, the elbow, the ankle, the hip, or the wrist. During this procedure, the doctor will insert a tool called an arthroscope into the joint through several small cuts to see how much damage is in the joint. The treating doctor can also repair many injuries through an arthroscope. Next, we have laboratory tests. Analyzing the patient's blood or joint fluid can help confirm the diagnosis. Blood tests. Although there's no blood test for osteoarthritis per se, certain tests can help rule out other causes of joint pain, such as rheumatoid arthritis, where you may look for the rheumatoid factor, which is a confirmatory test for rheumatoid arthritis. Joint fluid analysis. This is achieved through a process called arthrocentesis, commonly known as joint aspiration. The doctor might use a needle to draw fluid from an affected joint, either a knee, an elbow, or hip. The fluid is then tested for inflammation and to determine whether the pain is caused by gout or an infection rather than osteoarthritis. Now, what is the treatment for osteoarthritis? Treatment for osteoarthritis includes lifestyle modification, medications, and surgery. Lifestyle modifications used to treat osteoarthritis include the following: weight loss for patients who are overweight or obese, physical therapy. It may also include occupational therapy. We also have special exercise programs for people who have arthritis. And I think yesterday, Tongs spoke about some of the safe programs or exercises that you can do. For example, walking, without any, just not a brisk walk per se, but, your normal walk, or gardening, something that will not worsen the pain in your joint. And we also have orthosis to help to keep joints aligned and functioning correctly. And some of the orthoses that are used include splints, it includes braces. We also have assistive devices such as walking aids, a walking cane, example, a walker. Some people even use electric-powered seat lifts, raised toilet seats, tub and shower baths to also assist with patients who have osteoarthritis. And above all, arthritis education and support. When we spoke about chronic conditions and adherence, we mentioned that it's important for a patient to understand the condition that they have, to know what causes the condition, to know what worsens the condition, and to know what to do to actually assist, maybe protecting the joint, and the patient also needs support, belonging to a support group, or even someone who can, come and join us as SAOPA, just to listen and ask questions if they have any questions regarding their condition. Next, on our treatment, is medication. Medications used to treat osteoarthritis include analgesics. These reduce pain, but they have no effect on inflammation. Examples include paracetamol, which is a medication that is used to treat fever and mild to moderate pain. Another example includes tramadol, which is also used. It's actually an opioid pain medication that is used to treat moderate to moderately severe pain. When taken by mouth, this has an immediate release formulation. The onset of pain relief usually begins within an hour, and it is also available in the form of an injection. We also have topical therapies. By this, what do we mean? It's a medication you can apply either a gel or cream to the skin or the mucous membrane to allow it to enter the body from there. Medication applied this way is used to treat pain or other problems in, to whatever specific part of the body that you want to treat. And topical medication can actually be used also to nourish the skin and protect it from harm. We also have topical non-steroidal anti-inflammatory drugs. Topical non-steroidal anti-inflammatory drugs are applied to unbroken skin where it hurts in the form of a gel, cream, spray, or plaster. Topical non-steroidal anti-inflammatories penetrate the skin, they enter tissues or joints, and reduce processes that cause pain in the tissue. We also have non-steroidal anti-inflammatory drugs that are taken orally. These also reduce both pain and inflammation, and they can be purchased over the counter, or some of them can be prescribed. And examples include very commonly known Brufen, which is referred to as ibuprofen, and also naproxen. We also have topical capsaicin. Capsaicin is also used to help relieve minor pain associated with rheumatoid arthritis or muscle sprains or strains. We have corticosteroids. These are anti-inflammatory medications. Prednisone is commonly used, and prednisone reduces inflammation. However, it may suppress the immune system, so it will only be prescribed for severe cases of osteoarthritis. We also have glucocorticoid injections, which is an injection of a corticosteroid. Sometimes they may combine it with an anesthetic. It is directly given into an individual joint, and it can reduce inflammation and pain due to arthritis. The effect may last for several months, but repeated injections can increase cartilage loss. So you need to be very careful when you go for these kind of treatments. Surgery is usually the last resort to treat severe osteoarthritis that significantly limits a person's activities and that does not respond to other treatments. Types of surgery for osteoarthritis include realignment surgery to realign bones and other joint structures that have become malaligned because of chronic osteoarthritis. If you can look at the picture, the top one is a normal, healthy knee joint. The bottom one is an affected knee that shows malalignment. Another type of surgery that can be used is fusion surgery. This is used to permanently fuse two or more bones together at a joint and may be indicated when the joints are badly damaged and joint replacement surgery is not an option. Joint replacement surgery is used to replace a damaged joint with an artificial prosthetic joint. And coming to, this is my last slide. It shows a slide of a healthy knee at the top. And then the other one shows a badly damaged osteoarthritic knee. You see there the cartilage is damaged. And next to that, you see an artificial knee, which has a prosthetic, which looks more or less the same like the healthy knee. So an artificial knee joint has metal alloy caps for your thigh bone and shin bone and highly density plastic to replace damaged cartilage. So in conclusion, osteoarthritis cannot be reversed, but treatment can reduce pain and help the patient move better. So what can you do for yourself? Lead a healthy lifestyle, take your medication, ask your treating practitioner if you do not know how to take good care of yourself. Thank you. I hope this helps you understand osteoarthritis better. If you have any questions, I'm going to ask Patrick to give you the WhatsApp group number that you can use to post your questions, and we will get back to you as soon as possible. Thank you. Thank you so much. I hope you all enjoy.